So Kathy has to be different than everybody else I see.
With her picture?
Of course I do, Mark.
I'm not surprised.
We've always known I'm the special one.
Well, that's a separate conversation.
No.
Something's not right.
Okay, Fred, go live in 3, 2, who's got the microphone? Yeah, you told me. Fred's mic's on. All right, go live.
Good. I'm going to start the recording and then I'll go through housekeeping items. Okay, the recording has started, and by being present, you are giving consent to be recorded. And then just as a reminder, in addition to the live stream, this will be immediately uploaded on the Health Department's YouTube channel. Again, just for utmost transparency, and if people want to view, obviously right now, not as many people can be here, so we're doing it that way. So we do have division directors that are on the call just because we couldn't get them all fit in the room safely, and safety, of course, is of utmost importance. So they will be here to answer questions, and I'll let Vivian take it away.
All right, good afternoon, everyone. We're going to call to order the Board of Health meeting for August 17th, 2021. We want to welcome our new board members. And can we have roll call, please?
Candace Clevenger, present. Vivian Goodman,
Here.
Jan Hack,
Here.
Debbie Hill,
Here.
Dr. Greg Jerger,
Here.
Susan Crown, Dr. Venkat Menegati, Dr. Janet Patterson,
Present.
Mark Scranton,
Here.
Cody Parks,
Here.
Jeff Edward.
Here.
Are there any additions to the agenda, any changes or? No. Okay, and we have a motion to approve the agenda topics.
So moved. Second.
Thank you. And roll call.
That was Jeff, Mark, and then Jeff.
Candace Clevenger,
Yes.
Vivian Goodman,
Yes.
Jan Hack,
Yes.
Debbie Hill,
Yes.
Dr. Greg Jerger,
Yes.
Dr. Janet Patterson,
Yes.
Mark Scranton,
Yes.
Cody Parks,
Yes.
Jeff Edward.
Yes.
Thank you. Is there any public comment?
We did not receive any, and there's no one here.
On to approval of previous meeting minutes from July 20th, 2021. Do we have a motion to approve the minutes? Or were there any changes or?
One minor detail, it's not a big detail, it's somewhere in the minutes, a couple places it mentions Mike Scranton, so I'd just like to clarify that for the record.
We can make that edit. I did not catch that. Mark's name popped up as Mike in a couple places.
Okay.
It was during the hearing, the minutes where the hearing's at, a couple different points.
We can definitely get that fixed.
Not a big deal, because it's correct throughout the rest of the meeting, so I just thought I'd mention it.
One other point of discussion, just so you all know, for the hearing, Mike Baggett also wrote up like a final document, sent that to us. Kathy and I reviewed that, and then we also sent it to Vivian and Jan, who also had to sign off on it, and then that was put in the record and also provided to the business owner, just so you all know.
And Mike did an excellent job.
Yeah.
Okay, so can I have a motion to approve the minutes with the corrections?
So moved.
Second. Okay, roll call vote please.
Candace Clevenger. Approved. Vivian Goodman.
Approved.
Jan Hack.
Approved.
Debbie Hill.
Approved.
Dr. Brett Jerger.
Yes.
Dr. Janet Patterson. Approved. Marcus Branson.
Approved.
Cody Parks.
Approved.
Jeff Edler.
Approved.
Thank you. Motion carried. Communication, Brandy.
So only thing to go over in this agenda point is just a COVID-19 update. I have a few things with this. If you've been watching what we've been putting out and also the news, things are getting worse very quickly. Not just when it comes to the numbers, but just the hospitalizations and what we're looking at with that, long-term care facilities, what we're dealing with that. I can tell you, we all kind of expected that this would probably come, but thought maybe more into the school year. So the fact that we're already seeing some of this before the kiddos have even made it back in the school is very concerning. We did do a press conference on Friday with some of the members of that crisis communications team. So it ended up being us, city and county were present, they did not speak. And then Tanya from Crossing, the Federally Qualified Health Center, and then also both local hospitals. So we have been talking regularly, and one of the things that we were hoping would be effective with the public is letting them know more about what was going on in the hospitals. And because the hospital numbers are going up so significantly, not just here locally, but in many surrounding communities, and I mean really throughout the country, that's very concerning, because when your hospitals start to fill up, then people who don't have COVID but who have anything going on may struggle to get the care or the transfers or whatever that might be. So we did do a press conference with that. There will be more coming out about that from that group, but I definitely think that's something that the public needs to be aware of, and hopefully that will be something that might affect their decisions to take this seriously. Another thing that has come through is new guidance from the CDC, which this has been 2 weeks ago or so, but pretty significant, is that anybody that, any communities that are in substantial or high transmission as a community, everyone should be masked in all indoor areas, whether they are vaccinated or not. We put out a lot of communication about this, but I think there's still some confusion about it. Some people that don't know or don't understand, and then of course some people who just don't want to wear the mask. So we've been trying to put more out about that and stress the importance of doing that. And of course, businesses and all of our partners in the healthcare system leading by example with that. We did not lift the masking rule here at the health department because we were a healthcare facility. So as far as any kind of policy change, there has not been. We've done everything that we can to try to keep staff and our clients and patients safe in the building. You probably also have seen that there was an executive order that came out to mandate masks in schools. That was a huge relief because of the fact that what we have seen in other states with spread in schools, and what we've even seen here in Illinois over the summer in camps, and the numbers of outbreaks in children and staff at those different types of settings has been significant and very concerning. So they took that information and are trying to get ahead of that basically in our schools. So there's been a lot of schools you've probably seen in the media that are voting on this and all. We've been in regular communication throughout the pandemic with our schools in Macon County, public and private. And so we're giving them all the information and support that we possibly can and hoping that they'll take every precaution to keep everybody safe in those buildings. The guidance that has come out for schools, it's very complex. I don't know if any of you have looked at it, but when it comes to the contact tracing piece, we all know that it's 6 feet, 15 minutes, right? Well, in this new guidance for the schools, if both parties, meaning the case and the contact, have masked consistently, meaning in the classroom, not when they're eating lunch with their mask off, if they've masked consistently and both of them have masked, then you take that measurement down to 3 feet, unless there's other certain criteria that are met. So you're definitely going to probably hear people in the community that think they're getting different stories from the health department, and that's true, because depending on how a school district implements some of these things, whether it's masking or testing, that may affect the length of quarantine for these children and staff. And then if somebody is fully vaccinated and asymptomatic, they don't have to quarantine. So there's a lot of little caveats in contact tracing that are making it extremely complex right now, and especially when these schools get back in. So if you do hear that, that's quite possibly true, because in some ways it's very much going to be case by case, depending on what's happening in those particular schools. One of the things that's been pushed from the state and that we really try to be supportive of to our school districts is testing and having a very robust testing program. The Shield Illinois testing and Binax Now that they have access to is free to the schools. And to my knowledge at this point, we do not have any school districts that are going to implement that Shield testing. There was one district last year that did the Binax Now testing. And so that is all I'm aware of at this point. I'm still waiting to hear from some of the school districts, but there are also allowances for school districts that are allowing testing. So you may hear that as well, and that's not going to be applying here in Macon County because these schools are not doing it. I will tell you, our director of nursing has been in regular communication with our medical director, Dr. Dutt, which has been fantastic because he's been very helpful when it comes to getting through some of these and helping us make some determinations on how we are going to implement the different options for quarantine and contact tracing. Dr. Miniganti is always a great source of help and support as well through this pandemic when we've needed some guidance on different things. So just want you to know all that. Vaccinations are going very, very strong. We're doing walk-ins and by appointment right now. And I know there's been days when we've had people lined up at the door 15 minutes before our doors even open wanting to get vaccinated. So while the numbers are small, there are people who are making that choice. And then we also did just get something late this afternoon about that booster shot for people that are immunocompromised. So we have already been talking through our potential plans of getting those people vaccinated. So stay tuned for that, but we literally just got it this afternoon.
You
So
already have that?
it's a vaccine, it's the same vaccine.
Oh, it is?
Yeah. And then I know that in some areas they're telling people to have their medical provider administer that third, that booster shot, basically not third dose, but booster shot. And there's not a lot of providers here that are vaccinating. So we may have to have a different approach and,
So
other.
your doctor wouldn't?
There's not a lot of doctors that are doing it,
Okay.
yeah. So we definitely plan to make it. Like, we've already been talking through what our plan is going to be for those boosters. I know just this week we have like 8 different clinics. So we'll definitely be able to support that as long as our medical director signs a standing order and everything. But I just want you all to know, if you don't hear something about it tonight, it's because we literally just got it. So our team's working through that and we'll put something out to the public. We've already been getting a lot of questions about it. We had a site visit for our COVID vaccinations, and this was just, last week or the week before, so we've been vaccinating for quite some time. And they came in just to make sure we're doing things right. The site visit went excellently, so I just thought you all would like to hear that, because I was really, really proud of our team and have been this whole time. But when you have somebody come in and check to make sure you're doing things right and they walk away saying good job, then that's always a big win, especially in such a hard time. So I will say, I know there's been a lot of questions about staffing. We did bring back some of our contact tracers full-time that we had just adjusted to part-time when the demand was much lower. And so right now they're all totally maxed out. Thankfully, the state has something called the Surge Center. So if there's cases that we don't have enough staff to cover, or there's some health departments that don't have a huge amount of contact tracers like we do at this time, that Surge Center is there, and it is through the state. So that's excellent, because today I know when I was looking last night, like 11 p.m., there were 156 cases in Salesforce ready to be assigned today. And so I'm very grateful that the state has that Surge Center, because it's a source of support for us. But our team has gotten extremely busy very quickly. And there's a lot of people having to work, again, a lot of hours to get everything done and to ensure that things are being done correctly and thoroughly. And with all the changes that have been coming through with schools, that's impacting schools, daycares, and when we're having this number of cases, some of these cases have 50 contacts. So if you can imagine 156 cases multiplied by however many people they've been around, upwards of 50 people, the sheer volume of only contact tracing is significant. The other thing is any complaints that we get in. So if there's a food establishment, if there's a business and they're being non-compliant, for example, letting people work that should be isolated or quarantined, et cetera, we're the ones that follow up on that. And so that's a significant amount of time, that not just from nursing, but emergency preparedness, environmental health, administration. So I will tell you, your health department team continues to be amazing somehow, even though I know that we're all tired from this very long year and a half of this, and we're feeling very much like a little bit of deja vu from last year, but I do feel like we have a strong prepared team. They had to figure all this out fresh last year. And so I'm very grateful that they are here and sticking through it, but to be fully transparent with you, our team's having to do a lot extra right now.
So do you think, like the enzyme in the restaurant visit, do you think it's time to put back up the partitions and spray the fogger? And I mean, is it got to that point, do you think?
I think the partitions are a great idea, and I'll tell you, they're masked off, they're eating, there's more respiratory droplets. And then also with some of these variants that we do have here in Macon County, they're much more transmissible than the original strain. And so if there's anything that you can do to try to limit that spread, that's really helpful. And I think we all have to do what we can right now because this could get even worse, very quickly with variants happening. So just to kind of give you an idea, that original strain, you'd infect about 2 people if you were positive. Now, some of these variants are 4 to 5 people and could be 60 to 70% more transmissible. And so a lot more people can get sick from just that one original person. Now, there has been stuff that has come out about fomite transmission. So transmission that would be from surfaces that would possibly impact whatever cleaning measures you would be implementing. I know we've talked about that with schools. So that might be something, you should be able to find that on the CDC website, but if you need help, you can call and we can send you
the
that.
fogger, what we used to do, the fogger with the Imapure or whatever from the place, if we spray that, do you think that kills that virus? Or is it, do you not know yet?
Well, no, I think it's effective against the different strains, yes. And I think that even what they've learned about the fomite or surface transmission is that it's not going to be as transmissible in that way. So some of the things that were being done maybe aren't even 100% necessary, but I know they have a lot of details about exactly what cleaners and disinfectants you're using on CDC's website. So you can check that, or you can call environmental as well, and they'll walk you to it or through it or put you to that website to show you exactly where, because I know there's been some changes from like day one when we were doing this about what is needed. But I think those partitions can help because you do have those people sitting in close proximity, and that's a little bit different than your surfaces.
So Brandy, one of the things I've been kind of watching for a while, and now this is starting to appear to escalate a little bit again, and just feedback I'm getting from people I've had conversations with out in the community. I think sometimes less is more, and I think the public in general has been so inundated with this for a year and a half now, and my concern is I feel like we're starting to go into that role again as far as information being dispersed. I personally think that if a press release was put out, with statistics and stuff once a week, it would be sufficient, because whatever the health department does, the media takes it and they run with it, and then you get this thing where this is getting ground into the ground every single day. People get tired of listening to it, but I think they also turn it off. So if you have something meaningful to say, some of the things I've had some people ask me about is questions. Nobody has really came out with a clear explanation how the variants are being determined. I had some people said they've talked to some different physicians and said the only way the variants could be tested for was through a blood test to test for antibodies and stuff. I don't think that's been clearly explained to the public. So that's one of the things that I had a question on. that I think would be good to answer for people. And then there's also been a lot of people I noticed, I really have been spending, I don't know if anybody else has or not, but I really been spending a lot of time looking at the comments on social media with the health department's page. I don't see a lot of response back to the health department, which obviously is difficult to do, but again, less is more. So the more frequently you put information out there, the more you're gonna have this questions about, a multitude of different things. But one of the things was, are you going to provide any statistics in regards to people that have previously had COVID? Are they getting it again? Cases that are now appearing that are vaccinated versus non-vaccinated, which I think is a very legitimate question for a lot of people, because I've seen several stories about people that have been vaccinated for some time and they've got it again. I think those statistics might be of value to people, but the variant thing, when this first came out, I'm looking at, okay, how we have 141 people in Macon County that have the Brazilian variant, for example. I'm thinking,
spread throughout our country, throughout our state, throughout our county. So these aren't all people who specifically would have traveled to Brazil. It would be people that are now spreading it around, because that happens to be the strain that they got, and that's what's being spread around. And I will tell you, just so you all know, as we don't respond to every comment, we do sometimes, like if there's a commonly asked question, or we will develop a separate post to answer the most commonly asked questions. And then if people message us directly via, for example, Facebook, where they're doing a lot of that commenting, we answer every single one of those. So people can comment all day and they may not get a response, but if they actually reach out to us via that messaging component, email, phone call, any of that, they are getting responded to. They just have to, again, take that extra step to actually ask the question specifically or directly to us. And then you had the question about non-vaccinated numbers and reinfection. That information is being provided by the state. In some cases with this, we cannot locally report that out if we don't have all that information readily available. So what we report out each day, Monday through Friday, is every case that comes into us, we have a team that specifically puts that into basically data management process. And then they take all the information and put it into this reporting infographic and reporting method. We don't have an epidemiologist or anything on staff that can do like the higher level stuff, but we want to put our local numbers out. But the non-vaccinated, like the breakthrough cases and the reinfection information, that is available from the state.
Are you guys asking the question though, or whoever does the testing, are they asking the question if they've already been vaccinated though?
Yes. Oh yeah.
Okay.
And that's asked in contact tracing.
You guys
That's
aren't
all.
sharing that information. There's a lot of people asking that because you're starting to see more stuff. And again, the media drives a lot of this information or misinformation, whichever case may be. And I'm just asking that we do our due diligence to provide as much accuracy as possible. And like I said, again, the frequency, I think, is creating a lot more, especially the comments. If you guys only put a post up once a week, then you're only going to get comments once a week versus clearly every day, put something up there. I mean, I just think it creates more stuff for you guys to deal with.
Well, and I'll tell you, honestly, last year, I don't remember what month it was, but I tried to turn the comments off because what was coming through to my team and destroying them and the hate and the negativity, and it was not very productive ever. But Facebook does not have that possibility, so I couldn't turn them off. But I would say I do feel like, the team is very accessible and responsive. But where it was going last year, and honestly where I feel like it's going already this year, and it's just going to continue to get worse, I wish that I could do that, just because I feel like it causes a lot more confusion or harm, and then you have a lot of misinformation shared in there by members of the public as well, basically using our platform to put out information that's not true. So
You can't set the page up where you can screen comments to be screened by the admin before posting.
Well, we're a government agency, so technically, yeah, we can't do that. We can't delete comments. We can't hide comments. If legally we could, I would have done some, because there are some that have been outright terrible. Threats against my staff, threats against other members of the public. And frankly, if Facebook wasn't such an effective mode of communication for our community, I would turn the whole thing off. But I feel like a lot of people rely on getting that, and I do want them to have a platform for the actual true information. But it has been a very nasty, difficult platform in this pandemic.
Brandy, if you have 100 tests and they only screen 15 of them, how do you spread the numbers as to what kind of variance it is?
I don't know if I understand the question. You mean that from the state?
Yeah.
Like if they're only...
They don't test all of them.
No, so they just tell us, like we can pull a report from Salesforce, which is our contact tracing program. What is happening with this? Sorry, we got a new thing here this week, and it's obviously giving us some trouble. Sorry about that. We're trying to be progressive with the technology here.
Got it, now you can mute yourself.
Go ahead, Candy, I'm sorry.
As I understood you, if you have 100 tests, you don't really screen.
Do their sequencing, but then anytime a health department, if we request additional specimens to be sequenced, that would throw our number off. So I don't think there's an exact percentage every single week, month, et cetera. Because if we have, I know like when we've had an outbreak situation, we've requested specific people's specimens to be tested, because if you do have a variant, it's more transmissible. Quarantine automatically goes up to 14 days. There's no early release option because of the fact that it's more highly transmissible. So those are things that we try to figure out if we see that an outbreak is occurring. There's been these camp outbreaks throughout the summer. So those are things that they specifically have sequenced to see what is going on there to help determine what's going to happen in the future. So I'm not sure exact percentage. If you want that, I can definitely.
No, it just looked like when I looked at the last one, it didn't look like it looked like the number for Delta was small.
Yeah, it was not our highest. That is accurate.
So, that was surprising to me what's going on.
It was to me too. Honestly, it made me nervous that if, Delta's not real high here, is it like it's just not high yet kind of situation? Hopefully it stays like that. I mean, that would be fantastic, but I think we have to be prepared for if it, blows up.
But it seems like what we have is very contagious, the way the numbers are going, whichever one it does. So.
The other question, or the other thing that I'm hearing a lot of questions, how many sites in our area do we have that actually test? Are we sending everything to the state, or do we have local people that are testing?
No, there's locals. I could pull it for you if you want me to, but I want to say there's probably not even 10. It's like we have a thing that we've shared out, and it's an 8.5 by 11 sheet, and it's just one page. And it has all the contact information. If you all would want me to email that to you, I can, if that would be helpful.
Where I'm going with that is the feedback that I'm getting, kind of the same that Mark is hearing as well, is the information I'm getting is there's only one place that can test for the variants, and that's the state. Which, that's what I've heard from both hospitals.
So yes, because the state's doing the sequencing of it. So there's other places that can test.
And see, the problem with that is then it becomes very suspicious, like he's saying, because if the state's the only one who's testing that and no one else has the ability to test for it, hard to prove, or it's hard to justify or tell people, yes, it's legit, because our state's not
People
great.
have lost some
I
trust,
mean,
yeah.
honestly, there's not many people who trust our state. And if that's the only, if they're the only ones putting out the variants, then they can fudge the numbers. That's an issue that we have. Because if we're gonna go in there and all of a sudden here in a month or two, you guys are gonna throw out lockdowns, it's gonna be an issue. It's gonna be an issue because people are not gonna trust it. Like the Mark said, people are
Doing it as
worried.
this afternoon, August 20th, it's gonna mandate in Chicago. They're getting ready to do this like next week.
The mask.
So, I mean, that's
Well,
gonna
it'll be
be,
down here.
I foresee that being an issue that's coming up because people are tired of it. They don't wanna do this in the first place. And if they find out, which is true, what you're telling me is that the state is the only one who can test the variants, no one trusts the state. And we're gonna catch it, and we gotta be prepared for it. You guys are gonna have to be prepared for that. I mean, I know you were talking about the ugliness that came through. I'm not talking about the ugliness, but that's gonna come
You
through.
can't legislate a mandate if you're not gonna put a little bit, I mean, we're gonna make the schools, because of the ability now that the state leadership has over the schools, but I personally haven't gone, but I've talked to several people that have gone to state fair since the weekend, and they said this is what you're gonna have to do if you go to the fair, and nobody's enforcing it, and virtually nobody was complying, not even in the track areas and things like that. I've seen all kinds of pictures on Facebook and stuff like that where people were down the track. If you're gonna tell people you gotta do this, either make it happen or leave it alone and let people make their own choices. And I think, like you said, it's starting to wear out. And that's my concern. And we keep putting such a high volume. I mean, there's local media that is literally beating this thing in the ground every single morning on the air. And they've been doing it for 20 months now, nonstop. And it's gotten old, and people are just, give me some information that I need to know and then move on. But I'm telling you, it's really upsetting people. I mean, it's just, I mean, you guys know it, but I mean, I'm not telling you things you don't know, but I mean, it's just, again, like we talked about, controlling the message and who's putting the message out there.
Right.
That's creating a lot of turmoil. So anyway.
Well, I do want to, and I think you know this, but just for clarification for everyone, for if you are asked a question, the tests that are performed by these other entities, they can detect these other variant strains. So when they come back positive, they're really positive. The part that's being done at the state is just the sequencing to determine what strain of the coronavirus is it. So if you have people in the community saying, well, if others can't test for the variant, well, then they're not testing or it's not accurate. Even if, I think our message can be, regardless of who trusts the state or not, these positives are still positives. So when we reported, over 100 new cases today, there's still 100 new cases. Regardless of if we know for sure what strain they are or not, that's still 100 something people that are sick and then that have close contacts who could end up sick, et cetera. And so I think that's a good message to stick on, and that these tests can detect all of these variant strains so far. They just can't tell you what strain is it. Does that make sense? So the test is still legitimate. It's just the state that's saying it's this variant or it's not a variant, et cetera.
All right, what makes the difference on what variant? You have the virus. So, I mean, I don't understand that part. You got the virus, period. So what's the difference on what variant?
If the rules apply, no matter what poll you got, if the rules the same, to stay apart or what, I mean.
Right, for the most part, yes, that's extremely legitimate. Like I was saying, if it's positive, it's positive. It's positive, you've got the coronavirus and you're infectious to other people. If it's a variant, then they would possibly not be eligible for a 10-day early release quarantine, but otherwise, yes, the rules are the same.
So that's the only thing right there.
Pretty much right now, and I mean, that could change. If we get to the point where we need to move back to a full 14-day quarantine, then that may be what we have to do, and then it'll be the same across the board, no matter if you're a variant or not. And oftentimes, By the time the state sequences these specimens and we get the information about it being a variant, sometimes those people are already out of isolation. So they sometimes don't know they have a variant while they're infectious, but they know that they're positive. They know that they're sick. They know that they're infectious to other people. So that's why it's important to keep the message, no matter if you have a variant or not, you are positive, you need to take these precautions. You need to contact the people you've been around, have them quarantine, et cetera.
So then again, to clarify, so on your weekly reports you're gonna be putting out, are you gonna start including in there people that have tested positive that have already been vaccinated?
Right now, that's available from the state. Right now, we are not putting that out ourselves. It's available from the state. But I just talked to one of our team leads in the contact tracing group last night about there may be a shift from the state with giving us that reinfection information via like Salesforce, which is the contact tracing, in a way that we can report it out more quickly. But right now, it's already available from IDPH. And we've sent out that
doesn't know that in Macon County.
That might be true. So I mean, we can definitely tell them.
Ethnicity and age groups and everything else. You look on there's a lot of people asking the question, how many people have gotten vaccinated or getting COVID again? So I think it's something that we need to start sharing.
I can definitely take that into consideration. I will tell you, we do not have the staff to, like when we contact trace, we ask if someone's been vaccinated, we verify in iCare when they were vaccinated. That is all uploaded into the contact tracing piece of it. But right now, we do not have staff that can then take that information and put it out into.
But you said the state's got the numbers though, can't they just give that to you?
I can definitely check on
Okay.
that. I mean,
That's
yeah.
what I'm asking.
I mean, there's more
That doesn't
information.
Work, but I mean, the
Yeah.
information's there.
Yeah, that's definitely something I can check into. But I think they might be changing something with that soon anyway, so stay tuned, but I can definitely check on that.
Have you heard of a lot of people who've gotten the vaccine getting COVID?
I don't know what the exact percentages. I will tell you, so when they first started reporting like reinfections, the definition of that was anybody who had been fully vaccinated who then ended up positive. Breakthrough case. Let me reverse. Breakthrough case was defined as if you've been vaccinated and then you end up getting COVID. Then, because of the number of people that were ending up in that situation, they converted that breakthrough definition to people who had been vaccinated but then ended up being hospitalized or passing away. So that information is all available from the state. I don't know the exact percentage off the top of my head. Same with reinfection. I would have to check though, and I definitely can do that about like what the percentage is and if that would be something that we could report out easily. But yeah, I can find out.
Yeah, because everybody's so positive. Oh, I got my shot. Oh, I got my shot.
Yeah, that's my concern. People are getting false sense of, I got the vaccine, so there's no chance to get sick again.
Yeah. So they think that's why I asked that question.
Well, there have definitely been people, and we have put out the message and have kept trying to do that about vaccines are not 100%. This particular vaccine is incredibly effective, very highly effective, but no vaccine is 100% going to prevent you from getting whatever that particular illness is. The point is that it hopefully won't be as severe of a case, or you won't be hospitalized or lose your life in that situation. The number of people, and we have not put this out locally because we don't have all this data super readily available, but the people who are being hospitalized are more often not vaccinated. And in the hospital, they put out information in that press conference Friday that more of the people being hospitalized now are in that younger population. So they're seeing younger people who are needing longer hospital stays. So the demographic has changed a little bit with that as well. Any other questions or comments about COVID stuff?
Thanks for the information.
No problem, and I'll check on that.
On like the, at St. Mary's Hospital on the COVID floor, is there any like regulations that keep people from freely walking in and out?
Like visitors?
Anybody?
They did just change their visitor policies last week at both local hospitals. I don't have them memorized or anything, but what I know is it's basically one visitor in some situations. People can be allowed to. I know the example they gave was like having a baby, but it has to be the same visitor the whole time. They can't swap out who they're having on day one versus day two. It has to be the same one. But they both adopted those. I don't know what day last week, but it was just last week. So there shouldn't be just anybody, to my knowledge.
Last week I was at St. Mary's. My wife's grandmother was there. and she has colon cancer. We went there at 7:30 at night on Wednesday. Nobody's at the front desk. We walked in. We walked down on an elevator with the fourth floor, COVID floor. That's where they had her. Nobody was on that floor at all. I didn't see one person. Not one person asked us anything. The first day she was there, they had only 2 visitors. Had to be the same visitors, which was a husband or that brother and sister. After they put her on hospice, that evening they put her on hospice. And there was no limit on visitors. We went there to visit her again. There were 7 people in the room. There was no regulations on nobody checking for masks, nothing. We walked in, nobody asked us nothing. We walked down the hallway, nobody asked us nothing. We walked out, not one. We didn't even see a person out, not one person out, nowhere. It was curious.
Well, what I
It
can
changed
say,
Friday.
Huh?
It was
Oh,
Friday.
was it? Okay.
Yeah, it was my day
We was there
after
Wednesday,
surgeries.
Wednesday and Thursday.
So it was Thursday, Friday they sent, they told me that that all changed when patients I brought in on Friday, so.
and I can't speak for the hospitals.
No, I was
obviously,
just
you
curious,
know.
because it seemed weird that she was on COVID floor to begin with, because she didn't have COVID, but, so there was no, I mean, there was nobody asking, nobody. We was, family was walking in and out freely, nobody was asking no questions, checking for masks, I mean, nobody, nothing. So, I was just curious.
Sorry, I can't answer more to that. I'm sorry about your family member.
Well, thank you, Brandy, for all the information, and while we know you have no control over, none of us have control over the state or any other entity, we appreciate everything that you and your staff are doing to keep our community as safe as possible, so thank you for that. Okay, presentation and acceptance of financial report.
Okay, if you will look at your financial report, look on the front page, you can see up there, this is as of July 31st, at 67% of the year having passed. You can see total revenue at, I need to put that on actually, okay. 5.5 and total expenditures 5.3, and then you can see beginning fund balance was at $5,225,431.87, and then ending fund balance $5,423,373.83. And if you look at the second page, you can see on there total revenue and total expenditures broken down in more detail, and down there toward the bottom, the total revenue being at 5.5 million has us 74% into our budgeted revenue. And our total expense being at 5.3 million has us at 72% into our budgeted expenditures. And then when we get into, well, does anybody have questions on that part before I go into the expenditures notes that I wanted to share? Okay, we'll do the acceptance of that, and then I have more for the other part of it.
Any questions for Brandy on the financial report? If not, we'll entertain a motion to approve. Financial report. Thank you, Rick. Thank you. Roll call vote, please.
Candace Clevenger.
Approved.
Vivian Goodman.
Approved.
Jan Hack.
Approved.
Debbie Hill.
Approved.
Dr. Brad Jordan.
Approved.
Dr. Janet Patterson. Mark Scranton.
Approved.
Cody Parks.
Approved.
Jeff Edler.
Approved.
Thank you, motion carried. Review and approval of department expenditures.
Okay, so I have just a few notes, if you all have had a chance to look through that, and I'm happy to answer any questions, but wanted to point these things out. You'll see some of the higher dollar amount expenditures throughout these different documents. Sam's Club was one that stuck out a little bit, I thought, at $5,611.75. That was some year-end grant spending that we had to complete and for the end of a grant. And so that included diapers, wipes, pack and plays from Walmart and Sam's, and that would have been through like our WIC, family case management programming. CDW government, you'll see one in there for $1,105.30. This would have been batteries for Starting Point, which is our aging and disability resource center for seniors and people with disabilities, and that would have been laptops, and it was 8 of them. Travelers, that is medication management liability insurance for us. Illinois Department on Aging, that is a repayment of some unused grant funds in the Emergency Senior Services Program. And then the DWD Technology Group, $2,900. That would have been custom reports in our new financial software. For our newer board members, we as the county have recently moved into this new accounting program called MIP. And what the health department chose to do in that process was adopt their time clock program, which is called EWS. And so that time clock program is much more thorough, higher level, gives us even better accounting than we had before for our grants to ensure that people are working in the grants for the percentage of time that we are predicting or billing for. So it's something that has moved us forward in a really positive direction. So just if you're wondering what the financial software thing is, or if you've seen anything that says MIP or EWS, and I know I've offered to meet with both of you, so we could definitely go through all of that in much greater detail. And then you'll see on there Striglow's $1,383.60, and that's 40 boxes of copy paper. There was one more I wanted to point out that was sizable on the August 5th report, and that was general corporate fund, the admin fees, and you can see that was March to July of 2021, and that was $370,000. That was the fee that we pay to Macon County for administration fees, and that's something that we have to pay, and so it was just for a significant amount of time, which is why that amount looks a little bit higher than you may have seen on the past if you've been on the board for a while, so I just wanted to point that out. Happy to answer any questions that you may have.
I have questions on two checks, Brandy. One to Staley Credit Union for $85.26, and then one to Amazon Capital Services for $2,087.
So the Staley Credit Union, that is various credit card charges. So most things we try to do with checks or purchase orders, but sometimes we do have to use credit cards if there's certain orders or anything. So that one that you referenced, that one that's $8,526, that would have been various credit card charges with that Staley Credit Union card. And then what date was the other one that you referenced?
It's on third page, I believe, of your expenditures at the top, Amazon Capital Services from 722 to 722.
Okay, hold on a second.
The very top of the page, there's one on the following page for 217.
You know what, let me switch, because I'm looking at a more detailed report than you are, so let me look at the one that you have really quick, so I can cross reference here. 722 Amazon, and that is. I have from Amazon, we purchased a safe from Amazon, because the one we had before broke, and that is the safe that we keep in our CFO's office. We had to purchase, journals and guides for our Better Birth Outcomes program, headlamps, a lactation manual, a vacuum screen protector, wood screws, and screwdrivers. And then I have on here a security camera, a desktop calculator, and a tape dispenser. And now I will say that was from all four that I just went through. I just went over everything from Amazon, just so you had all of that.
So is the charges on the Staley Credit Union, is that a pretty typical average month, or would you consider that to be higher than average, or?
I would have to check and see exactly how much that usually is. I would say there's a good possibility, just going from the top of my head, that this particular month, because these are June charges, that this was maybe a little bit higher than some of the other months would be, just because June, a lot of IDPH grants end on June 30th. So a lot of times if there is funds remaining in a grant and we are allowed to purchase certain items, whether they're supplies or anything else, some of that end of year grant spending will occur in June. So a lot of times you're going to see a little bit higher of expenses coming through, all of which have already been budgeted for and approved, and there's grants to cover it and all. But generally you are going to see a little bit higher in June just because we are doing the wrap up at the end of the year.
So how many credit cards are you talking about that are used within the health department?
I would need to check with my CFO to know that 100%, but I will tell you, there's not very many. Do you know exactly how many? 5. Okay. That's Lakia. If you
I'm assuming those are being utilized by department heads, for the most part.
It's very, very controlled. They're all kept in the chief financial officer safe. We have an entire checkout program, so if someone wants to use a credit card, they have to check it out, sign it out, and then check it back in, all of that. And generally, it usually is only department heads or the people who are conducting procurement and administration. So Lakia, Cherie, Bethany, me. We have one administration employee on leave right now and one who resigned. So generally, we do have a couple administrative assistants also that do more of our purchasing. However, there could be other people throughout the health department that may check out a card. An example of that would be when we can travel again to training or something. If someone has to take a card for a hotel or for food, then they would possibly check out a card even if they are not a division director. So that would be an example. Or if we have a health educator that has to go purchase supplies for an event, that person may check out a card to go purchase that stuff. And then when they come back, they have to turn in the receipt, they have to do a payment request sheet, that all goes through their division director, and then also goes through Lakia and Cherie in administration. And depending, if it's over $250, it has to come into your Bethany as well, before it's signed off on and everything.
So it sounds like you have good controls in place.
We really do, yeah. We have, Cherie has been our accountant now for, gosh, I think she just celebrated her, not our accountant, she started as accountant, now she's our chief financial officer, but for about 10 years, and we've come leaps and bounds, and I do feel very, very confident in how safe and well streamlined things are. And Lakia has been our accounting assistant, is moving into accountant level duties at this time, just because she has been an excellent asset in administration and being able to assist with the fiscal responsibilities, and with having, we have been more short-staffed and are looking at restructuring our administration division. And so really excited that we have Lakia, who has brought a wealth of experience and has really, really helped us get through some tough times. But yes, I think that we have excellent processes, policies in place. And between us and then what we also have to do with the county, as far as checks and balances with all of this, we've got it very well controlled. And just as a reminder, and then for our new members, another thing that we do, and this will have to be transitioned as we have a new treasurer, but Candy has been so kind to be doing it, as Candy used to be our president. But when we have these cash reports, this is every week, these have to go to a board member. It'll be switched to Sue soon, and this is what we had talked about taking turns with board members a couple months ago. But this is sent, Candy reviews this for us, so then we have a board member basically reviewing it and having eyes on it. Once that is done, it comes back to us, I review it and sign off on it, and it goes to the county. So we've got a lot of eyes on what we're doing all of the time. I know it's a long-winded answer, but I'd rather be thorough, and I know a lot of you are learning a lot and, you know, getting to know us, so.
Just like having controls in the financial area.
Yeah, I feel very confident. That's why I was like, buy that safe, because we gotta be able to get into it when you need it, get in quickly.
Well, with all the grants, you have to have those controls.
Oh, yeah, you do. Absolutely. Even more now, right?
Okay, any other questions on the department expenditures? No? You need a motion to approve.
Approved. Make motion approved.
Second. Thank you. And roll call vote?
Candace Clevenger. Approved. Vivian Good. Approved. Jan Hack.
Approved.
Debbie Hill.
Approved.
Dr. Brett Jerger.
Approved.
Dr. Janet Patterson. Approved. Mark Scranton.
Approved.
Cody Parks.
Approved.
Jeff
Approved.
Edler.
Motion carried, thank you. Any grant applications?
No, we're not.
You have the department division reports in your packet. So hopefully you guys had a chance to look at those. Are there any questions? Are they still on?
We do have several on. There were a few that could not this evening, but I probably could answer your questions if you have any, if that division director isn't on. For our newer members, usually our division directors would all come to this meeting so that you would know them and have that ongoing relationship and be able to easily ask questions. But just because obviously we want to keep people social distance and as safe as possible and allow room for the public to attend, I do have my division director staff joining via the team. So if you have questions for them, we can definitely have them pop in. And then for anybody that hasn't gotten to meet Bethany, Bethany Stable is our assistant public health administrator. So Bethany backs me up, and if anything happened, would step in interim for me.
I had two questions on the clinical nursing
Yes.
report, just because I've seen this pretty much consistently the same over the last, since the last year. Is there any anticipation with some of these clinics being opened back up? Because I was looking and saw we had 62 COVID clinics year to date. We've got 0 flu clinics, 0 STD or STI clinics. The lab testing is also 0. I mean, I know COVID has consumed everybody, but at the same time, we have needs of the public that need to be met for some of these other illnesses. And what's the mechanism here to get this going again, or, other than, face-to-face interaction, causing this, because these people have these issues. They obviously got to go somewhere, and the health departments, want places that they want to go to versus taking time to have to go to the hospital for something that they can get services for here.
And we completely agree with you. So a couple things with that. The first thing, to address your flu question, flu clinics have not started yet because we don't even have flu vaccine yet. So our team is already in the planning stages for that. So they'll go just like any other year, and they will be vaccinating here, but also providing offsite clinics. So a lot of years there's different entities that invite us to come in, whether it's a business or a church or a school, and we will actually take our team out to administer that flu vaccine and make it as accessible as possible. And then as far as STI Clinic, that is the only clinic and only thing really right now that the health department is not able to offer through all of COVID, despite all of the challenges. I will tell you a little bit about how our STI clinic ran before COVID, and how that was that we had a provider that would come over from Crossing, the federally qualified health center, because for certain types of tests or treatments, you have to have a provider. We do not have a provider at the health department. So we would rely on that person coming over for 2 days a week, and it would only be 2.5 hours on each of those days. So we started looking at options of collaborating possibly with SIU. We were in conversations about that before COVID so that we could grow what we were doing, and also looking at implementing a brown bag program, which is where people could come and just give a urine sample, so that there were some things that we could do even if a provider wasn't here. And so because of staffing and just not having enough staff during COVID, we did not have STI clinics. So we already have met with Crossing about getting them back over here. There's been changes in leadership with SIU, so I'm not sure they're even interested in continuing with us, but just to get it back going, we've already been talking to Crossing about seeing if they can send someone over here. We tried to have an even stronger partnership with that, and be able to use the medication that we receive as a health department and use it in their center, in their STI clinic, which would make that continuity of care without the possible gaps. Because for some things, if someone's tested in your facility, they can be treated before they leave. Some things they cannot. Some things we have medication for that Crossing may not have medication for exactly at that moment. So we were trying to put that together so that they could have some of our medication, we could have their provider, and then when people get tested, if they find out they're positive, they could be treated right there. Because once they leave, you may not get them back for treatment. The state said no to that, so we're still working on them, but the state said we have to use our medication, we have to only use it in our building. So now we're trying to see if we can get a provider over here. So that's all already in the works, and we completely agree with you, Mark.
I'm just looking at the numbers. You got 1,000 cases, but there's no clinics. So I mean, that tells me, you got literally, over 100 people a month.
Oh yeah, we have very high STI rates.
We spend time focusing on, COVID, but this stuff was here before that, and I'm concerned that we're letting some of these other illnesses kind of fall through the cracks because we're either not devoting time to them or don't have the resources or whatever the case may be. And I'd just like to see some level of activity start to appear back on these reports again and some of these things, because they've always been there. So.
Well, I will tell you that you will, but also unfortunately, to be completely blunt and honest, sometimes at a health department, what we do has to be driven by if we have funding for something. And so, or what rules basically are put upon us. So we completely agree with you. We are very passionate about the STI rate here in Macon County and making accessible services for everyone that needs and deserves those without them having to go to the hospital for that or having to go to another agency. So it's definitely the top of our priority list and working with our director of nursing to get that back going. And they're very passionate about getting it going as well. Unfortunately, with STI, there's not really funding for staffing that, so it is difficult. We can't just say, here's money for a provider, bring their provider in, and we're good to go. We have a clinic 5 days a week. I mean, that would be fantastic if we did, but it's not realistic. And then when we have something like COVID where we are required to respond, and we do have the comprehensive health protection grant where we do have to respond to communicable diseases, you know, we're definitely not forgetting about STIs or anything else, but sometimes in the public health world, what we do is guided by that just because we sometimes don't have the choice.
And that's kind of ironic, because if we can't provide those basic services here, all of us sitting here are foot the bill for that when they go to the hospital at much substantially higher costs, I suspect. And time of getting timely service provided and everything else. So we're paying probably dearly for not being able to provide these basic services here, which I think is the core value of what the health department should be doing.
I agree.
So just food for thought.
And we are on it, so I definitely agree with that.
Do you have a thought on percentages cared for by crossing? I would suspect these numbers are coming.
So we get all of them for Macon County, but yes, Crossing does have their clinic. So there is somewhere, thankfully, we've been able to send people. It's not that they haven't had anywhere to go, but of course the goal is to have more than one location if possible so that you are as accessible as possible. And of course, some people in the community don't feel comfortable going to location A, so they want to go to location B or they're not going anywhere. So yes, as a health department, definitely communicable disease, including any STIs are a priority of ours. And like I said, we're already in communication trying to get the provider here. If they say no, we're going to be confronted with a new issue. We're going to go to SIU and see if that'll work. And if they say no, we're going to do what we can do, which would include, you know, going and doing some brown bag testing, but that's not fully comprehensive either. So we have a lot of potential plans and are already working on those, but some of it is dependent on what others say or will agree to do in partnership with us.
All right, moving on to employee recognition. We have our August anniversaries. Whitney Ellison, 70 years. Hayden Marley, 7 years. Sarah Stackenborough, 6 years. Rebecca Stewart, 40 years. And Irita Lincoln, 1 year. So we appreciate the staff. Wish them a happy anniversary and thank them for their service. Moving on to old business. New Board of Health members, you wanted to say something on that?
I think that you welcomed them very well at the beginning, but welcome. We are happy to have you and thank you for being willing to serve. We appreciate it.
Okay, American Rescue Plan Fund update.
Okay, so we've been talking about this for several months now, and I did send an email out just to kind of give you a little bit of an update. A few weeks ago, I became aware that the county was going to, with the money that they're receiving, which is $20.1 million, that they were going to do a premium pay bulk amount based on how many months people had worked in the pandemic and whether they were full or part-time. I became aware of that and that we were potentially not included in that. So I did reach out to do some homework on if we were included. We were not initially, and I did, I communicated that out to you because I did think it was important for you all to know that. I did speak with some county board members and members of that committee and the finance committee because they were going to be voting on it that subsequent Monday. I think I found out Thursday, maybe. So what ended up happening is we did have some advocacy on behalf of some of them, and there was some clarification. Some of them were told that we already paid this to our people or that we had our own money to pay this to our people, which we do not, and we have not done that. And I did go to that meeting. They did have discussion. They did decide to include health department employees. And so as of right now, if the county does that, we are included. I know just at the county board meeting this past Thursday night, the treasurer did bring up the point that they have not gotten final approval from the actual funder yet to do this, but it has been voted to be approved if the funder approves it, if that makes sense. So I just wanted to let you all know that. I was obviously not happy when I found out that we were not included in that, and wanted to make sure to provide clarification because I know there was kind of some misconceptions about the pay that we provided to our staff, which was time that they worked, not like a nice thank you kind of bonus thing, which this is what this is. So I'll keep you posted if anything changes, but I think that that was really great that they made that decision. I was very thankful.
Did the explanation of how the process is being done in regards to who's getting the money and who's not getting the money? Did that make sense to you? Because I know there were some questions from some of the members about that.
I thought it made sense. In the actual resolution, it talks about what months would be covered, which I think were April 1, 2020 through March 2021. And it was a certain dollar amount per month if you were full-time versus if you were part-time. And you only got paid for the months that you worked. And then you only got it if you were still employed as of X date, which my understanding was the date of the meeting, but I'm not sure after what the treasurer said about it not even being fully approved from the funder quite yet. I'm not sure if that date will change or not, but I thought I understood.
I'm just asking a question for the benefit of everybody, because we have Jeff Etler, who's a county board member here, and of course you were at the meeting, and so was I, but it took a little bit to process that, and when Mr. Oliver started asking questions, I was like, yeah, that's some good questions. So it sounds like we have this, we want to give it to those that should have it, but it's almost like we're getting the cart before the horse, because the feds, I think Mr. Jackson said there was like 600 groups out there so far that have gotten this funding. I think we talked about it prior to the meeting. And he said nobody's actually pulled the trigger on that money yet. So I think everybody's kind of sitting on their hands to make sure it's going to go through. Is that what you understood, Jeff?
Exactly.
Because part of me says that's great to let everybody know that everybody's on board with that. At the same time, it's almost like I hate to tell people, hey, you're getting a present for Christmas, but we're not sure Santa's going to show up with it.
Well, I will say, now obviously we're in an open meeting, so this is all public. And for the most part, I communicate things with my team a lot because I feel like they should know what's going on. But this is not something that I put out in any way to staff. There was only a few of us in the building that were aware of it while I was, having those conversations and showing up to that meeting, because I thought, yes, if morale is already a struggle with going through a pandemic, and if they found out they were excluded from this, that's like devastating, first of all. And then second of all, I also don't want to get their hopes up if it doesn't go through. But now that it's been in open meetings, I feel like it's fair that they know it too, and that I'm just being honest.
I'm glad it was clarified at the meeting the other night.
Yeah, I thought.
Answer everybody's questions.
In that full resolution, they do have it on the county board website, so if you want to read it, I felt like I was clear on the way that the money was used. Cherie, our CFO, was even able to take that language and come up with a spreadsheet very quickly that determined how much the health department staff would actually even be getting paid if we were added or included or whatever. So I think it was clear, but hopefully it goes through. That's all for that I have.
All right, thank you. Budget process schedule.
So just as a reminder, we do have our meeting on September 7th. That's a Tuesday. We will do an agenda, all of that like normal, but I just want to remind you to have that on your calendar because we have to have our budget passed so that we can show up to our hearing on September 13th with the county and be able to go through that. The Finance Committee will meet in advance of that meeting, and then we will hold the full meeting with everyone. So just as a reminder of that. And then two other things I want to make you aware of. We will have our pay grade scale available for you to approve that night as well. For people that have been on, if you remember, that shows like the levels of staff and what the base pay is. And then for those of you that are new, we have a standard formula basically that we use, that anybody that would come in as a certain level of staff, and then it determines if they're exempt or non-exempt, what their titles would be, and what their pay level would be at base pay coming in, and breaks it down full-time and part-time. We update that every year. If we do any kind of cost of living / merit increases, we do adjust this accordingly. And so we also get our board approval of that. So we will be bringing that to you as well. And if you recall from my goals, and I certainly have not done it alone, there's been a team that's been working on it that deserves credit, but we did get the salary assessment done. We had an intern that helped, and Bethany did a lot of work on that. So Bethany, Cherie, and I are supposed to meet on that here soon to go over the results of the salary assessment to determine if we need to make adjustments in any of those levels to our pay to keep us comparable with other health departments, and then of course other healthcare organizations. Of course, we're not usually anywhere close to other healthcare organizations such as hospitals, long-term care, et cetera. But public health is a little different, so we did gather information from other health departments to make those as informed members as possible. So that goal has been accomplished, and we will bring you a little bit more information about that when we present the budget.
Madam President, to dovetail into that, so right now, I'm looking around the room, we have 4 new board members. Who's on the finance committee? Because I don't even know, and if people that were on the finance committee are no longer here, then do we want to appoint anybody tonight to be on that committee prior to this meeting?
You have this, I do, okay.
So the people that are currently on it are Candy Clevenger, Vivian Goodman, and Sue Krause, our new treasurer. And that's generally the number of people that are usually on the
So, okay, from
finance
that
committee.
perspective, okay.
Yeah.
I just want to clarify that.
I double checked that because I was concerned.
Well,
saying
I started
that-
thinking about committee assignments, that's on my list that I had.
Yep.
For
And we-
committee assignments, if there's any holes that need to be filled.
And there is, so I plan to put that on next month. We have a vacancy, Dr. Zimmerman was on the bylaws and nominating committees. So, we do need to get someone appointed to that next month. So that'll be on next month's agenda.
Okay.
We can't do it tonight because it's
No,
not on.
that's fine, I just thought about the finance committee.
Yeah, we're good on finance committee, and just so you all know the way that it flows, I can't remember how detailed I was in the email, but finance committee will go over it in very excessive detail, and then we bring it to the full board immediately after, the same night. And then, you'll kind of get more of a summarized version, but have the opportunity to answer any questions that you would have. And our CFO will be here, so if there are things that need to be broken down even greater than, what I do, then she will be here to be able to answer those questions too.
Business cards. You know, well, one at a time, business cards.
Okay, so I put these as 2 different things just because I know they were kind of 2 separate discussions. So for newer people, we talked about getting business cards for board members and then getting email addresses for board members. So just so you kind of are up to speed a little bit. I did check into the email addresses more thoroughly with IT. They can definitely make it happen. They've already checked. I know I gave you price last month. It's $4 per user per month. And then if you all voted to do this, it would be a domain of BOH. Well, it would be first initial, last name, and then at boh.maconchd.org. So it would almost identically mirror ours. It would just have that BOH piece in there, so then it would make you distinct from our staff. I know I had said I thought we could do a group like we had talked about last month. I did verify with IT that we can do that. So if that's the direction that you want to go with making a group, then that's definitely doable if you want to do that. And then business cards, I think that just needs to be a conversation, but I did make them separate in case the board does want to do email, but not cards or vice versa, whatever. So I'll let the board take this discussion away.
I'm not in favor of doing group email, and I'll tell you why, because it's going to create a lot of confusion, in my opinion, about where the emails are being generated from originally, and likewise on responses. And to educate the new board members, and Jeff, you can understand since you're on the county board, right now there hasn't been a mechanism for health department board members to have a unique address tied to the department specifically. And I know the county board just kind of has moved that direction. And my concern is I don't want to have any of my personal or business stuff tied to correspondence back and forth with the health department. And the conversation was, the city's doing this, everybody else is. It provides a wall of separation for any FOIA requests, things like that. And not only that, I think it just looks a lot more professional. And that's kind of what I brought the business card thing, because I used the example of somebody from city council I ran into one night, had a question. He pulls out a card, it's got the city Decatur's address, it's got his city Decatur email address, his name, doesn't have his personal phone number or anything like that on there. It's like, here, drop me an email and I'll get your request or information or whatever directed to the right person. I think it provides a better channel of communication as we correspond. But, I was advised not to have, any intermingling of things. And if I'm going to go get a separate email address, it might as well be, he's doing AOL, she's doing Yahoo, you're doing Gmail. Let's have some across the board that's clean and it looks, I think it gives us more credibility as an organization. And that's why I brought it up to the board last month.
Sounds like a great idea.
I got no problem paying for cards unless somebody's got a real strong objection to have cards. I'd probably never pass any out. But now somebody's gonna ask me, hey, what's your email address? And I'm not gonna remember what it is.
I actually have a thought about that just popped in my head. So I know part of the discussion last month of the concern with business cards was that when you order them, you usually have to get, 700 or whatever it is, and you just don't get through a lot of business cards like that. That was one of the reasons we talked about a group email, so that then we wouldn't have these business cards that people use and then they're garbage. So this does add a little bit of extra work, but if you're looking more for passing it out for email purposes, I wonder, could we just get cards, and then do like a blank and then at boh.makeathd.org, and then you would have your own, that you would just put your first initial last name rather than everybody having 700 or whatever each.
Yeah, who do you guys use for printing right now?
Here lately, we've used Vistaprint because it's been a lot more
Because
affordable.
I know you can go to Staples and you get cards done for next to nothing when you do small quantities. I've got a place specifically that I go to for my business stuff, and they will print a quantity that you want. It's just a set of charges that it costs. I personally have no problem paying for it out of my pocket, just because I would prefer to have it that way. But it's not up to me. There's 11 other people that have the opinion about it. But the email thing, I think, is something we definitely need to do.
Anyone else have any?
So, with the email, that's where Brandy would send us all our information. Is that your plan?
What's that?
With your email, Brandy would send us all our information to my Board of Health email. If I want to talk to you, I had to use my Board of Health email.
Right. Yeah. Because you need to have, for your own protection, you need to have a separate email address for any interaction you have, because I get thousands of emails a month, and if I got FOIA'd, I'd have to separate all my BOH stuff out from everything else. That would be an absolute nightmare. You even talked to state's attorney about it, and he highly discouraged it. So you're gonna have to create a separate email address anyway for the purposes of the board. And I mean, when you're not on the board anymore, of course, the board will pull the plug on the email. So you got control over from that perspective too. Plus, I think your IT guy, we talked about this before, is doing it through that process, because you guys have stuff on the servers, stuff's encrypted and saved and protected, and so there's some other added benefits that he had mentioned to me when we had a conversation about that as well. Others doing our own stuff because we have the protection of your guys' IT people, with that too. So I think it's a good CYA, but besides just like I say, the propriety of communication, communicating back and forth with each other, to make sure we're not violating the Meeting Act. And if somebody does do a FOIA request, it's going to be channeled towards the health department, and then Brandy's going to deal with it. Somebody's going to have to.
I never read my personal email. I only read my work email.
Yeah, you could do it mine's an Outlook app, that's how I use mine. And I keep it separate from my personal.
My business too. But if I had to go in extra and log in every day to see what I got from.
You can have it forwarded to your other email too. Link them together.
I don't know.
Believe me, I'm not tech savvy by any means.
So does it end up on my other computer's email then?
Yeah, it's.
Yeah, before, like to your work email, it would still come to your work box, it would just be a board, that email.
So I would have all the protections and stuff.
Yeah, we still show up in your work email, but your personal or work email can still be FOIA if you're using it for health department business. So whether you have a separate one or not, if you're doing anything with the personal, it can still.
So when you email us, would that change everything else?
Yeah.
Oh, no.
Yeah, it would go to the other email address, if that's what you're.
You're gonna have your, whatever email you're using,
Yeah.
that's gonna be subject to FOIA.
But only what they FOIA. So someone can't say,
School.
someone can't say, I'm FOIAing Debbie's conversations with her friend Jill, or, so, like, it has to be,
Has to be
I'm
related to the health
FOIAing
department.
Debbie's conversations with Jill about the Board of Health. So if you haven't talked to Jill about the Board of Health, there's nothing, like, there's no responsive document.
The problem is you have to sift through everything to find what you're looking for. It's time consuming, I can tell you that.
You don't know how to type in and search?
No, I'm saying when somebody asks the question, they're gonna have that ability. You're gonna go through and do a search. Whether the rest of the board agrees to do this or not, I'm gonna get a separate email address, because I'm not gonna have it intermingle with my personal business email.
Well, let's think,
Well,
The
I-
state's attorney even recommended against doing it, so.
let's think about that.
I mean, against having it not, or against doing this. What was the state's attorney's recommendation?
He highly recommended not to have your personal or business email tied to any governmental correspondence. He highly encouraged us to do this. The county board just finally did it, and they've been doing it the exact same way for how long, Jeff? I don't know, you don't have it on
The
there.
new emails are only about 2 months old.
Yeah,
so-
the county board just finally started doing it.
In fact, they're still going to both the old and the new. So, there's gotta be a transition for a few weeks, months. But yeah, they mandated, the county board mandated that.
And do you, at Fort River, do y'all pay for that?
Oh, no. It's on the county's site.
Can we, think about this till the next time
That's up to all of you.
and come up with a good idea?
But this would be
You know,
a
if it
deal for
doesn't
the health
afford-
department.
If you're worried about having to go 2 places, then it forwards to the other one, it could look the same to you, is what he said.
Right, yeah. Yeah, you can set
It could look the
up.
same to you, so you're not having to go over 2 emails. And also, I don't know if you get your emails on your phone, so I get both my work and my personal on my phone, so if I put it on
Yeah,
my
I do
phone, as
It's
another
really easy to
list,
set it up.
then that alleviates me having to do a separate process, I'll just leave it on there. At that point,
Whatever you decide.
But it's gonna take a while to get it implemented to start with, so I really hate to postpone this, since we talked about 2 months ago. Postpone any longer.
Already have 7, so what's one more?
Madam President, I'd like to make a motion that we approve to get email addresses for board members.
Second.
One more discussion. Roll call.
Gladys Clevenger,
approved.
Vivian Goodman,
Yes.
Jan Hack,
Yes.
Debbie Hill,
I don't know.
I think you have to pick yes, no, or
I am still learning, so I will go with anything that you all decide. I'm not,
Is that a yes or is that a?
I guess I'll say yes.
yes,
Well, I know it's for you.
Dr. Brett Berger,
I'm coming down to your place.
Dr. Janet Patterson,
Yes.
Mark Scranton,
Yes.
Cody Park,
Yes.
Jeff Eckes.
Yes.
It's unanimous, yes.
Okay, motion carried. Where did we go with the business part? Anywhere?
I'm willing to wait on that. Let's
Okay.
take one step at a time.
Well, I just wanted to make sure we were talking about,
I don't know, does anybody else have an opinion about one or another?
I kinda like-
Be the only one driving the conversation, I hate to be doing that.
I kind of like
Get some
your
input
idea
from
about
everybody else.
these blank ones where you just, what do we about 10 of those a year? I mean, to fill it in.
Exactly.
Get some generic business cards made up, and then we'll give them to Kathy, and then Kathy can sit and write our email addresses, and pass them out the next board meeting.
I'm about to say she might not have time to do that.
I think-
Mark, I put your email address on every single card.
Thank you.
Okay, so moving on to safety discussion update.
Okay, so we talked about this last month, and we talked about the keyless swipe entry and getting that taken care of. I have not heard back from the second business that I reached out to, so I'm gonna try again with that one. And then I did ask for a contact name from the Decatur Public Building Commission, from Detection Security, that's who our alarm is from. And I know they also put this equipment in. I also talked to the building commission last week about the cost around this, because we did request money from that county American Rescue Plan money. We haven't heard anything back about that, but the building commission said they could probably work with us somehow. I don't know what that means, and I don't think it's a promise, but there could be a chance money-wise, if we don't have money, that we could try to see if they might have money to do that. So just stay tuned with that and know that I am working on it, and it's definitely on my radar. Another major thing that I just want to put on your radar is that we, within 1 week, had to do 2 lockdowns of our building. I'm sure in the news you saw that there were a lot of shootings happening in Decatur in general. Some of them happened right out here. We had 2 different days that we had employees trying to get into or out of their vehicle and heard gunshots. And so we immediately initiated a lockdown process with that, contacted the appropriate people that we had to contact, put out messaging through our emergency alert system, had people staffed at doors and all of that. So I just wanted you to be aware of that. And we're obviously communicating with our staff and trying to tell them, like, we're not doing that to try to scare you, but we are going to do everything possible to keep you safe. So we're erring on the side of caution with that. And if we need to lock it down because someone's shooting right outside and there's 10 cop cars, like, that's what we're going to do. So I just want you all to know that. And then I did ask the building commission about the possibility of, and I know it sounds extreme, but bulletproof glass in our windows and doorways, and if that's even a possibility. I mean, we've got, when some of these things happened, you know, we have staff that are literally sitting mostly on that side of the building where the police were and where the shootings were, who are scared to sit in their offices, that they might get shot by crossfire through their window. And, you know, shootings can happen anywhere. It's not just here. And, you know, so no matter where we were, this could possibly happen. So we're trying to find things that we can do to help keep our staff, in addition to locking the building down, which in some cases might even happen after the fact. What else can we do? So they're looking into options for that for us. And then they also, in some buildings, I think the courthouse, they said they've done this film that you can put on glass that helps from.
That's what I was getting ready to just
Yeah,
say.
so
There is a ballistic film you can put on glass that would like be.
Yeah, and they're pricing that out for us.
Those.
So I'll let you all know.
How long has it taken you from the time you initiate a lockdown to actually be implemented and completed? Do you have an idea on the time frame it takes to get it done?
Yeah, I mean, it's a matter of minutes. So generally, if something happens, it's immediately reported, and we've told staff like where it needs to be reported to as far as who's immediately available. If it's an emergency where they need to call 911, we've told staff, you call 911, you're an adult, you don't have to check with anyone, and then immediately report that to your supervisor. But it is to be reported to supervisor or one of us or our emergency preparedness coordinator, Whitney, Allison, whoever is immediately available. And what is reported in these 2 cases was an employee hearing what they were pretty sure was gunshots. So at that, or if they see a heavy police presence in the area. And there have been times in the past where we haven't locked down, but if there's been a lot of police like within this block or something, we may send something to staff that just says like, be cautious in the area, there's a heavy police presence. But when we heard gunshots, that's why I wanted to take more aggressive action. So while Whitney is sending out an emergency alert to all of our staff to don't come back if you're out doing home visits or at lunch or whatever, anybody in the building, stay in the building for right now, and we will let you know when we know more, when you can leave, basically. And then at that same time, we are contacting Decatur Police Department to find out, hey, what is going on? Because we have asked them to proactively contact us if we should be going on lockdown. But in both of those cases, we heard nothing except for from our staff. So we have called them and asked them, like, what's the situation? You know, what do we need to be doing? How seriously do we need to take it? But usually in those situations, if we feel like it merits a lockdown, we start it before we even really know anything for BPD. But usually we have at least a couple people working on it, because one's sending out a notification, one's calling BPD, and then they reconnect immediately after that. If it's a situation where it's like, I think I heard gunshots, I'm not sure, then we would call DPD. Is there something going on in the area? What can you tell us? Do we need to lock down, et cetera? Sometimes they say, we have no idea. Or the first time they said, we don't like, we think there might have been gunshots, but there's really no room for concern. And to me, that wasn't enough, so I locked the building down anyways. And right or wrong, I stand behind that decision because I'd rather be safer. And so it's not always, Mark, to answer your question, super black and white as far as what criteria I guess I use when I have to make that decision. But I always err more on the side of caution. And if that means that our staff may not be able to get immediately back in the building, if they have to come in 15 minutes later from their lunch break, or if they can't leave unless they have an emergency, but at least they're informed that there's something happening in this area and to be extra careful. So I don't really have a number.
That's the whole reason I brought it up before he was kind enough to take me around initially for a tour of the building. That's one of the first things that triggered through my mind, because you do need to protect your people here.
Yeah.
So controlled access to the building is really important. I would suggest maybe send an email to the sheriff and maybe get somebody involved from the sheriff's office in regards to ballistic films. I'm sure that he would have some recommendations, or someone on staff would have some recommendations. But my initial thought would be, before you get to a real extreme cost, would be exploring, put ballistic film up and see if they're using that in other county buildings other than ballistic glass, because more and more places are doing that nowadays, mainly because of the cost factor. But you know, there's certain things that are not going to get stopped even by ballistic glass. But I would say to do that at a minimum. You know, look at the film, and again, the keyless access, I think, is a real necessity for you and your staff, as we talked about before. So I'm glad that you're continuing to move forward on that as well.
Yeah, absolutely. And I will say, when I met with the building commission on Thursday, they have done ballistic film with the courthouse, so they worked with sheriff's department on that, and they are already getting pricing for me for that film. So I will, I should have an update on that, but that might even be something that is part of what the building commission would cover financially, so I'll update you about that. But if we don't have to pay for it, then that'd be great. But if it's something that we would have to pay for, then, you know, obviously we would bring that to you.
Brandy, can I add something, please?
I'm sorry, what?
Can I add something?
Yes, of course.
So we also, when we did go on lockdown, through Teams on our computer, we were alerting the supervisors as to what the situation was. So when, you know, they had staff calling in going, what's going on, they could explain it to the best of their ability based on that employee. I think we all know that some employees can handle that a little bit better. Some employees may have some type of PTSD already. So we did not want to put, when we do the emergency notifications, why exactly we're on lockdown. We leave that up to the supervisors to determine that based on their employee.
The only thing real quick before we move on, if you're able to obtain that information, if that's going to be a decision that we have to make to approve expenditures for, it might be really beneficial, since money's not in the budget right now, to have that at least a dollar amount before the finance meeting conversation takes place, just in case we need to allocate funding in there for now if we don't have any currently available. I'd like to see it done sooner than later, but.
And we will definitely do that. And what I can say is, we will probably put it in there regardless, along with like our digital environmental health that we're looking at, because even if, let's say the building commission says, actually we'll cover that, well then cool, we just won't spend that out of our budget, or we'll make an adjustment later, but then that way we have it approved already so that it's just ready to go. So we will do that. Okay, that's it on that safety discussion part.
All right, open meetings, that training update?
That website is still down. I checked today. Jeff, you probably already have that training, but for new board members, you have to take Open Meetings Act training within 90 days of being put in your position, but that website's down. So right now you cannot take it. You can certainly learn more about Open Meetings Act. It's all online and you can read it if you choose to. I'm happy to answer any questions that you have, but as soon as that's up, we'll let you all know so that you can get on there and get that taken care of. That's it with that one.
New business?
Nothing in them.
All right. And closed session, anything?
We do need to go to closed, yes.
So we need a motion to go into closed session.
I make a motion to go in closed session.
Second. And a roll call vote.
Candace Clevenger,
Yeah.
Vivian Goodman,
Yes.
Jan Hack,
Yes.
Debbie Hill,
Here.
Dr. Brett Darker,
Yes.
Dr. Janet Patterson,
Yes.
Mark Scranton,
Yes.
Cody Parks,
Yes.
Jeff Bismarck.
Yes.
All right, so give us just a minute. I'm gonna stop the recording and then we're gonna stop the live stream so that the meeting is truly closed. And division directors, thank you for joining. You can hop off now.
Thank you. Good night.
All right.